You can begin.
Hello, everyone. I'm going to give people time to log on. We already see people coming in, which is exciting. So I'll just give folks a second. Welcome, welcome. We're so glad to see people coming on. And we will just give you a chance to join us. Welcome, everyone. We see everybody logging on. We're so excited to see everyone. It's a great turnout so far. Just going to give it a few minutes to let people log on. Okay, I think we have quite a few people on, and we'll let people sort of come in as they can. Welcome, everyone. My name is Dr. Mati Latroyo Davis, and I'm the Director of Health for the City of St. Louis. I want to welcome you all to our virtual public health town hall. I'm so thankful that with everything you all have going on, you prioritize being here with us this evening. It means a lot to me, and I think we're going to have a great evening. So I'm going to start off by just letting you know what to expect by way of agenda today, and then we're going to go ahead and dive right on in. So this evening for me is about a discussion with you, a discussion that I hope you will see is bidirectional, with as much as a virtual medium will allow us, to share what's going on in the Department of Health and to hear from you about public health needs and questions. So let me take a minute and outline the rest of the evening. We are hoping that Mayor Jones will be able to join us shortly. She'll be providing some brief comments. Following Mayor Jones' remarks, we have with us the chairperson for the City of St. Louis Joint Boards of Health and Hospitals, Serena Mohammed, and she will also give some remarks. After that, I would like to introduce you to my staff. I think directors and appointed officials get a lot of the glory. And I have an exceptional leadership crew and team here who have been the force behind a lot of great work that the health department is doing. So I'll move on to that. After that, though, I'll give you a few key updates for the Department of Health, but we're going to spend the bulk of tonight talking about questions. We got over, I think, 80 or close to 100 questions sent in. Thankfully, a lot of them mirror each other or overlap. So we're going to try and do a give and take between answering those questions and taking live questions from the audience. If you have a question that you'd like to ask, we're going to ask that you use the question and answer period function here on Zoom. The only thing that I ask from you tonight is that we remain respectful of other attendees and of each other when we communicate, regardless of how we may feel about things. And anyone who does not do that will be removed. But other than that, I am a very transparent person. I'm here to have most of this be open and clear dialogue about public health and the road ahead. Let's move right on into the program. Unfortunately, the mayor's already sent her apologies. She has an emergency. She wishes she was here with us this evening. So I'm going to now move on to the chairperson for the Board of Health, the support group, the leaders that have led us alongside us in public health for decades now, Serena Mohammed. Serena, thank you so much for being with us today.
So thank you, Dr. Mati. I would actually like to add my welcome and thanks for everyone who has chosen to spend a portion of your evening with us to discuss public health in the City of St. Louis. As chairperson for the Joint Boards of Health and Hospitals, I regularly hear innovative ideas about public health policy, practice, and service from a distinguished board of volunteers who serve with me. Our membership includes medical doctors, clinical therapists, policy experts, and more. We use our time together to think through how we can best partner with and support Dr. Madi and her exceptional team. But no matter what the topic and what experts are in the room, a consistent question that we always ask ourselves is, what do city residents think about this issue? And how can we marshal our resources to prioritize the needs of residents? From board members to staff, we are all committed to genuinely listening to diverse community stakeholders to ensure that our actions match our vision, to ensure that St. Louis is an equitable community achieving optimal health for all. In order to fulfill our mission, we understand that it is important to hear directly from you. That is why we are so grateful for your attendance this evening. The Joint Boards of Health and Hospitals meetings are open to the public. You can always join us on the third Thursday of the month at 8 a.m. There's more information about how to join on the city's website. But while we have you here, one thing we would appreciate is your response to two questions. And I'm going to post these questions in the chat. First, how did you hear about this town hall meeting tonight? And second, how do you normally hear about community events? Where do you get information? We look forward to seeing your responses so that we can continue to stay in touch and keep our lines of communication open. It's very important to us that we know how to reach you and that you know how to reach us. So I will turn it over to Dr. Madi to move us forward with the agenda.
Thank you so much, Serena. I have to be very honest. Serena is mentor, friend, partner, answers the phone whenever, has done so, has led in our communities for years and years, does not seek glory, but has helped every facet of city government for decades. So to have a chairperson who has been an ally for years before she took on this role means everything to me. And part of my goal tonight is for you to understand kind of how we function, what we do and what we don't do, so that you are clear in your head the work that we need you to help us achieve and advocate for us moving forward. So thank you so much for that, Serena. And I'm going to ask you to answer the questions that she posed. She posed them again in the chat if you need them. So I would now like to, like a proud mama, move on to introducing my fearless executive leadership team. Their names are displayed here on the screen, and I'm going to ask them to introduce themselves, tell you a little bit about what they do, and one project or goal that they're excited about that they've reached, just so that you can have an idea of the inner functionings of the health department here in the city. So I will start with our fearless bureau chief on the fiscal side, Emmanuel Kani. Emmanuel.
Thank you, Dr. Madi. Good afternoon, everyone. My name is Emmanuel Kani, and I am the head of the Fiscal Bureau. And in the Fiscal Bureau, we basically support all the departments that we have in health, environmental, communicable disease, and all the other departments. So we process contracts and process invoices and make sure that we take care of all the payments for the things that we do here. So one of the big projects that we are working on in the fiscal section is the APA, managing the APA funds and making sure that those funds are properly directed to the things that they have been earmarked for, and making sure that they are properly managed and reconciled and ready for audit when audit comes. So we are very busy here, and we are grateful to have Dr. Madi as the director over us at this time. Thank you all so much.
My leadership team is very humble, so I just want to show off one thing, is that Emmanuel has led us through 3 successful audits this year. We saw one of the largest improvement in one of our biggest federal audits, where we had a lot of findings 4 years ago, and they commented in the final meeting that they'd never seen an improvement that large. A lot of that is due to the leadership and implementation strategies of Emmanuel and his team. Because you need to understand that unlike businesses that can operate in isolation, fiscal has to work with multiple other city departments to be able to get basic fiscal needs done. So it's a lot of cooperation, and I'm thankful. I'm going to move swiftly along to Sylvia Jackson-Bell, head of our grants administration team. Sylvia, thank you for being here. Tell us a little bit about what you do.
Thank you, Dr. Monty. And good evening. Welcome everyone to tonight's event. As Dr. Mati indicated, my name is Sylvia Jackson-Bell, and I am currently the Provisional Program Manager for Grant Administration. Now, just as our name implies, we administer federal grants to local programs, services, and organizations that provide services to low-income persons living with HIV and AIDS. Our major funding comes from HRSA, which is funding through Health Resources and Services Administration through its HIV/AIDS Bureau. That funding is really presented to communities that have just the most severe numbers in terms of folks living with HIV and AIDS. Those service categories include the provision of core medical services, as well as supportive services. And those are things such as oral health services, vision services, and all of this works through an intricate case management component. Another funding source for us are funds through our Housing and Urban Development funded HOPWA program. HOPWA is Housing Opportunities for Persons Living with HIV and AIDS. That program provides services such as short-term rent, mortgage assistance, tenant-based rental assistance, as well as facility-based assistance and supportive services, which is also a case management component. These programs, both HRSA funding and HOPWA funding through HUD, are complementary programs which work to provide a full healthcare and housing continuum of care for women, children, kids, men, and all persons in our community living with HIV and AIDS. You know, I am most excited about a new piece for us, which is our HIV housing needs assessment. That hasn't kicked off yet, but we're expecting it to become full bloom early fall. So more to come on our housing needs assessment for persons living with HIV and AIDS.
Thank you.
Thanks,
Sylvia.
Dr. Mati.
Your team is small and but mighty, and you have fought for the care, the wraparound care of people living with HIV for decades, and I'm so proud. I do have breaking news. My boss is here, and it's just I think it's such an apt way that she's joining us, because she genuinely had an emergency, as mayors do, and she still tried to make it a priority to be here. It's just very symbolic of how she has shown up for me time and time again since I started this job. Many of you may not know my background. I'm an infectious diseases doctor by training. I have a public health degree. I have no political, no city government experience prior to this. So to have a boss who, whether she agrees or doesn't agree, always has my back and takes time to check on me as an individual and as a member of her staff is everything. So we'd like to welcome you, Mayor Jones. I'm going to ask that we take the slides off so that we can see Mayor Jones and allow her to speak before she gets back to the business of running the city. Thank you, Mayor Jones.
Thank you, Dr. Mati. Good evening, and thank you all for tuning into this very important town hall. I'm so glad to see our Department of Health continue to connect with the community. Tonight, you'll receive an update on the state of COVID-19 in the city and the new normal moving forward. A look at the department's latest initiatives and be able to ask questions and receive answers. Dr. Mati, our fearless director of the Department of Health, is an expert in infectious disease, and she has a wealth of knowledge that she'll share with you this evening. I want to take a moment to emphasize time and time again, COVID-19 vaccines are safe, they are effective, and they are completely free of charge. They are key to protecting our schools, our families, and our communities. I made sure that my 14-year-old son, Aiden, got vaccinated so that he can keep enjoying in-person learning with his friends and teachers. I feel better knowing that he is protected from COVID-19 at school, and he plays basketball. So getting vaccinated helps make sure that he can stay on the court, shooting three-pointers, and continue to do the things that he loves. I've often spoke about losing my only remaining uncle to COVID-19 in a local nursing home. No family should go through that kind of heartbreak. And getting vaccinated is the best way to avoid serious illness, stay out of the hospital, and keep our families and communities safe. That's why I got vaccinated right away when I could, and got boosted, and I'm due for my second booster actually. So if you haven't received the COVID-19 vaccine, make sure to do so to protect your loved ones. If you're not fully boosted yet, make sure you do so. If you're a parent or a guardian looking to get your child vaccinated or have any other questions about public health, this town hall is perfect for you. Opportunities like these are great for you to get your questions answered from experts like Dr. Madi and her fearless team. And I'm so glad that I could join you today. Thank you and God bless.
Thank you so much, Mayor Jones. I can't tell you how much I appreciate it. We're going to keep fighting for public health, and we know you've got our back. So I will move steadily along and ask for the PowerPoint slides to come back. I'm trying to, I don't like holding people captive to lecture, so we're going to keep it to 1 minute to 2 minutes each to my leadership team and go to our next fearless leader, Justin Hauser.
Thank you, Dr. Madi. Hello, everyone. My name is Justin Hauser, and as Dr. Madi mentioned, I work in the Environmental Health Bureau here at the Department of Health. We have 6 main sections in environmental health, and it ranges from animal care and control all the way to vector control. So that's the whole spectrum from A to V. In between is community sanitation. We also have food and beverage control. There is emergency preparedness, as well as the vector control section. I've been with the department for about 4 years now, and it's not solely my effort, but one project that I am excited about is continuing the work of my predecessors to help modernize the systems for information management as well as the processes. We're moving into the digital age there at environmental health, and I'm very excited to continue that modernization. Thanks, everyone.
Thanks, Justin. So all of my staff are humble, so I'm going to brag a little bit. Justin probably leads the most diverse bureau here. He deals with our animals in the city, food, and COVID-19 vaccinations. All the clinics that the city has upheld for the last 2.5 years, this man here was at the helm. He is a leader, he's fearless, he's loyal, he loves his community, and he will show up whenever we ask. And I'm so grateful to you, Justin, and the team. So thanks for being here, Justin. Suzanne Alexander.
Why you gotta say it like that, Dr. Madi?
I'm excited.
Hi, everybody. It's a pleasure and an honor to be here serving you all and serving with my colleagues who I admire and respect. My bureau is communicable disease, and that is the transmission of infectious illness and preventing it through education, outreach, investigation, and community support. A lot of you know us from our work with investigating COVID-19 and from maybe calling our COVID-19 hotline, where one day we answered over 400 calls with 4 people. So we were a little busy. Others may know us from our work in monitoring, preventing, and testing for HIV and other sexually transmitted infections. But we also investigate other outbreaks, such as salmonella or listeria. Other foodborne illnesses, we monitor for influenza and other respiratory outbreaks, and we engage with schools and early childhood education centers to really safeguard our little ones and prevent the spread of childhood illnesses like hand, foot, and mouth disease. And we are very proud and honored to serve all of you. One thing that I'm really excited about is we are going to have a new website coming for our HIV testing and screening clinic. And city residents will be able to order condoms and HIV testing kits so that they can test in the privacy of their own homes. And you'll see us representing at Pride Fest, June 25th and June 26th with those same kits. So we'll look forward to seeing all of you there.
Thank you, Suzanne. One of the largest sections in our health department, creative, dug right deep into me when I said we needed to get policies in for the city of St. Louis. But what I am glad that you drew attention to, because my staff will never admit how hard it got in the pandemic, is having over 400 cases in the city and only 3-4 people on staff. Think about the toll that takes on folks. It's no secret that city employees have some of the more difficult to be competitive salaries. They went through a lot in the pandemic, a lot of stress being thrown around from coworkers and people in the community. And then to deal with that burden, that number and the capacity was a lot. So I'm so proud of them. And it's important that you guys know what's going on. And thank you for showing them love in the chat. It means a lot to me. Please feel free to have community in the chat and to tell us how you feel about the things you're hearing. So last and certainly not least, recently promoted from within, new section chief, Bobby Williams. Bobby.
Thank you, Dr. Mahdi. Again, my name is Bobby Williams. I work with the great people who work with women, children, and adolescent health. Our bureau focuses on the family, the community, and also the schools to ensure that we provide programming that is as service to both men, women, and children. And one of the programs that we are currently embarked on that I'm very proud of and excited about is our Food RX program, where we are endeavoring to bring services to lower rates of diabetes and hypertension within our communities. So if you ever need additional information or want to know what services that can be given to you that focuses on the family, the community, or school health, please let us know. Thank you.
Thank you so much, Bobby. It's such an important program, and really proud of you for your professional development and moving up and taking the lead. You've been doing a fantastic job. So our last bureau chief is going to walk us through some data. We have an epidemiology division, and I'm going to ask Dr. Moshe to kind of finish off this section of our program before we move into Q&A.
Yeah, hi everybody. Thank you very much, Dr. Matt. So I'll take you through quickly 4 of our main accomplishments, beginning with monthly communicable disease surveillance. Actually, the aim of this surveillance is merely to help us to map and understand disease burden in the city in order to take appropriate actions. So disease that we focus on our monthly surveillance include COVID-19 pandemic, influenza, enteric diseases, vector, and systemic diseases. Another specific areas that we do conduct monthly surveillance, including gun and violence. And we are happy that we're having a good relationship with the department, with the police department in this area. The second area is on periodic chronic disease surveillance, by which we are pulling data from different data sources, analyzing and reporting different disease profiles and specific conditions facing the city of St. Louis. Some of the areas that we manage to pull and report, as you can see in the list, include cancer profile, STD and HIV profiles, diabetes, cardiovascular diseases, substance use, morbidity, and mortality. And the good thing is that all these reports are available in our city website. So it's good to have time and review them. Next. The third area that the Epidemiology Bureau is supporting is research and publications. We are collaborating with our academic partners here in the city, particularly Washington University and St. Louis University, to execute scientific research work. Some of the ongoing research work, actually, they are at the final stage, including understanding the drug overdose fatality here in the city, mental health, epidemiological assessment, which is particularly important when we are trying to link with the COVID-19 pandemic. And another area that we are finalizing, working with is enabling hotspot detection and public health response to COVID-19. Last but not least, the area that the Bureau is supporting is performance management. With all this that we are doing, we believe that it is important to get back, to get feedback from the community to better understand their needs. And therefore, the City of St. Louis, in collaboration with the county, we are finalizing the community health assessment, by which we are getting input from our partners and the community. And on the side of the community, we are actually having focus groups discussion with particular vulnerable populations, thinking of seniors, with disabilities, physical disabilities, LGBT, MSM, immigrants, refugees, African Americans, and the like. So at the end of this, community health survey, with the, at the end of this community health status assessment, it will help us to shape our focus as a department. Thank you.
Thank you so much, Dr. Moshe. So proud of you. When I came on, there were only 2 or 3 epidemiologists in the whole section. We've now filled this bureau with 8 people. We're focusing on timely and specific feedback. And you'll be seeing more from us. And we need to hear from you, and for you to take surveys, as annoying as they are. We've got to maximize how we talk to you guys and see your needs reflected. So I know one of the things you want to hear about is COVID, and I have some breaking news tonight. So while I told you we're going to get to questions, hang on, you want to hear this. I'm going to do a little bit of teaching because that's the way I roll. I'm an ID doc and I do a lot of teaching and public health expert. So the first thing that's on your screen right now is the COVID-19 weekly data snapshot for the city of St. Louis. We publish this every Thursday on all 3 of our social media platforms. That is Facebook, Twitter, and Instagram. So follow us today. My team's going to be putting those links in the chat. Send those to your friends and family. And even if you don't like social media, just hang out with us on Thursday so that you can get the same kind of snapshot. This is a bit of a broken off one. It also has a quote from me about what I want you guys to focus on, and some other little pieces of information, all in one small, easy to digest snapshot. So the status and risk of COVID-19 has changed over the course of this pandemic. For much of the time, we focus on the number of cases being diagnosed and the % positivity rates of diagnostic tests. That's what you guys were used to getting. This is reflected in the transmission level. So that information is still being captured just in a different way in the transmission level. We've been in the high transmission level for some time when we think about cases and % positivity rate. However, at this stage of the pandemic, a majority of people have either been vaccinated or developed natural immunity through infection. So the population as a whole has some immunity to COVID. With this in mind, and the newly available access to antiviral medications like Paxlovid, the CDC has recognized that it may not make as much sense to focus strictly on the number of cases and focus on other metrics as well. So the focus has shifted to the more severe outcomes like hospitalization. That's what you see in this community level in front of you. The community level status has been added to the COVID-19 dashboard as well. My staff's going to put that link in the chat. This is an up-to-date, every couple of days dashboard where you can see a lot more information than when you get in this snapshot. And we show you both the community level and the transmission level side by side. But I wanted to make it clear what the difference is. Community takes into account hospitalizations and transmission does not. That's why they look different. We moved into medium just over a week ago, and the breaking news is as of 10 minutes before I started this, because my staff never stopped working, they refreshed the data, and we're now in the high transmission and community level in the city of St. Louis. For those of you that have been following us on social media, I've been telling folks that we have been at the volume of cases, at least of the Delta surge last summer. It's hard to get accurate numbers because people are not testing as much as they used to. Those numbers have plummeted. So we are definitely in a surge right now. And as much as you hear conflicting information from politicians and other people, my message has been clear and consistent since I had the honor of taking this role. And right now we are currently in a surge. So I'm going to move on to the education, but in Q&A, we will get back to this question here. But I do want to say to J.S. Thomas, we do have some updated data pieces. We're limited in how often we get data from the state and from the CDC. So you can go to the link that's above your comment in the chat and see what we have there. That's what we have that's most responsible to report out accurately and consistently. Next slide, please. So let's talk about vaccinations. What you see here is the COVID-19 vaccinations in the city. Vaccinations are one of the most important tools in our toolbox. I would say, I don't like to rank tools, but vaccinations and masking right now are our 2 most strongest tools in our toolbox. Being vaccinated and boosted specifically protects against developing severe illness and death. When I was an ID doctor until September of last year, I never lost a patient to COVID-19, and I lost many throughout the pandemic because I take care of the sickest because I'm a specialist who was vaccinated to that point. Those numbers have changed because there's new variants that are coming very quickly. We see more people in the hospital who are vaccinated be severely ill and die, but there's definitely a big difference between them. So this is an important tool that we have. Being vaccinated protects against developing severe illness, and now that 63.2% of city residents are vaccinated, we've seen the case fatality rate since then decrease substantially. The city has nearly finished updating the COVID-19 data dashboard and will now include vaccination rates overall and by select age groups. A preview of the additions are what you see on the screen. So you'll be able to look at these by age group and other different demographics as to how we're doing at vaccines. I need people to get boosted. I need people to encourage family members and friends to get boosted because that's the key here. So next slide, please. Let's talk about boosters then. Immunity has been observed to wane over time. That means it decreases over time. meaning a third or fourth dose of a vaccine may be necessary to keep your immune system up to date. We deal with this with flu, right? The age criteria for getting a booster dose was recently expanded to include kids age 5 to 11. Professionally and personally important for me because I have 2 children, 5 and 2, and not having a strong way to protect them has been harrowing, as it has been for many parents on here today. So a second booster is also recommended for older adults above 50 and above, and for anyone 12 and older who's moderately to severely compromised. So you see here some information. The graph shows the number of booster doses administered per day for first and second doses. You can see there's been a significant drop off. People are tired. People may not trust it. This is why we have to continue to do the work of public health. And you can see the pace of booster administration has slowed down to a steady pace, but currently 28.3% of the eligible population 5+ have been boosted at least twice, and more than 9,000 people have already gotten a booster. The last thing I want to say about COVID for now, until we get to the Q&A, I know there's going to be a lot of questions, is we do have a test to treat program at the federal level. Antiviral medications like Paxlovid and remdesivir can be effective in reducing severity and shortening the duration of illness in mild to moderate infections. I'm a lot of people's unofficial doctor and definitely their ID doc. They call me when they test positive. I encourage everyone, as I would for my husband, my mother, my dad, to see if they're eligible for Paxlovid because it makes a difference. So we do have this program. We've put a link here. You can look it up online. I'm going to ask my staff to put the link in the chat for you to find a place where you can get it at a pharmacy. Unfortunately, there's not a lot of options here in the Midwest. I've made that clear to the federal government and advocacy. But if you're fortunate enough to have a PCP or able to go to an FQHC, you can always ask to get tested and if you're eligible for these treatments. And FQHC is federally qualified health centers, the leaders and beacons who never turn a patient away and take care of our most disenfranchised. So they can get a prescription from a healthcare provider and have the prescription filled all in one location with the test. So people can use the new HHS ASPR locator to find test to treat sites near them, and that link is in the chat. So don't worry, I'm sure I've made more questions than I have, in the hopes is that I've taught you as well. But I want to get to the dialogue piece, so we're going to move quickly to a few exciting announcements. We're hiring. I need you guys to help us go to the event link, the Eventbrite website link that my staff are going to put in the chat, and ask people to join our first ever. I couldn't believe it. The Department of Health had never done a job fair, so we're doing a virtual one first. And then in thinking of folks who don't have access to internet, we're going to partner with various partners in the city, especially in our most disenfranchised neighborhoods, to do on-site job fairs. There is a wide range of jobs, as my executive staff showed you. We have people who do food inspections, work with animals, do communicable disease, write policy, do operational stuff. So we really encourage people to check the job listings. And again, I'm going to ask my staff to put that in the chat, but to join us June 21st at 11:30 a.m. for our first virtual job fair. Listen, public health was in shambles when I joined the health department. We went from having a staff of over 350 people, one of my senior staff members told me today, a decade ago, to now less than 100. We have high turnover. I had a staff member who was leaving and she said, I love working with you, but I'm broken. This pandemic has broken me. And so my job and my focus, if you ask me what my top priority is, the reason why I don't look for flashy headlines all the time is because I have to heal the department, provide organizational infrastructure and support, professional development, and advocate for, as the mayor has already shown to be able to do, increasing salaries for our staff. So please join us for that. And then the next announcement I'd like to make is based on your feedback. We did a survey at the end of last year and asked many community members, what are your priorities? I hope some of you were paying attention in the beginning that a lot of the priorities that we think of in public health weren't represented by my leadership. I inherited a health department where I was asked to do COVID and non-COVID priorities in parallel. And 3 of my top non-COVID priorities, there's not one person in the health department is hired to do. They either lost the people or they've never had that bureau, right? And what that means is we depend on then subcontracting out. Anyone who owns a business knows that's really hard to do. If you don't have a really robust administrative core to oversee those contracts, and you sometimes have to negotiate priorities because you're dealing with the contractor's priorities, not your own, it's difficult. So we will be announcing July 1st new Behavioral Health Bureau. I broke the record as a director for asking more money in the budget than has ever been asked before. They laughed at me, but I didn't laugh back because I was like, even then, I still am just asking for baseline things. We have not met fundamental baseline criteria for public health measures in the city for quite some time. And it causes a lot of stress on staff because they're constantly getting that feedback in audits and other reporting mechanisms. So I need to really build back. I'm getting a record 31 new positions for the health department to build back what we lost, some of that in the pandemic, and to provide a behavioral health bureau with mental health services. You'll be hearing more about that. I'll be working with key leaders, and you got to give us time because we're literally hiring one at a time, and that takes time. So even though July 1st is when I can start hiring, you may not see programming for a while, but this will allow us to address the opioid crisis and mental health in our most disenfranchised. More about that in the Q&A section. So, marathon of talking. I wish you guys could talk back. Zoom is super awkward. Let's move on to the next slide and start talking about questions and answers. So I'm gonna welcome Suzanne to join me. She's gonna help me. We're gonna go back and forth between questions that were provided earlier and questions that were submitted. There are some leaders, giants who I have looked up to my whole career who are on this call today. I see Dr. Will Ross, a previous Board of Health chair who has driven public health for decades in the city and continues to support us. I see Victoria Anwuri, who is one of the top leaders in the Institute for Public Health in the city of St. Louis. I see many of our aldermen and women who have taken the time to join us. Partners, Darius Rucker, Jamie Opsell, I see in the chat. James Page is here with us today. There's so many partners, and I'm going to try to shout out as many people as well who are here. So I thank you. I will try to give some of these answers to my staff to add on when it's helpful. If some of our leaders are here and if they can unmute, I'll ask them to join so you don't have to listen to me for the next hour and a half. But let's get into these questions. So the first question that was sent my way was, what are the 5 highest priorities for public health in the city of St. Louis? So I already kind of addressed this, but let's talk about, there's 2 ways of looking at this. The public doesn't always know what the capacity of the health department has. So I have internal priorities, and then there's what you guys have told us. So in planning for our health and promotion and education communication campaigns, like I told you, we conducted a citywide survey to ask residents to share their public health priorities. The survey revealed the #1 public health concern for residents who responded was, I want people to guess in the chat, what do you think the #1 priority for peeps in the city was? I'm gonna see if I can get a couple of answers in the chat. I'm trying desperately to be interactive, so bear with me if you think it's corny. But does anyone want to take a guess at what the #1 priority was from that survey? Okay, we got Natalie coming in with gun violence. Darius is coming in with COVID. I'm seeing a lot of COVID, 2 COVID so far. Affordable access to care, I love that. Safety, mental health, housing. STIs, mental health again. So we've got violence, we've got mental health taking the lead so far. Violence is coming in strong, but mental health right there with it. I would say maybe a tie, I can't keep up. Addiction from Jody. Okay, so that's great participation, thank you. And they're still coming in. #1 was gun violence, right? That is the #1 priority that came out from that survey. The survey revealed that this concern was followed by mental health and behavioral health. So what you're putting in the chat very closely mirrors what we got back, which is reassuring. This was defined as mental illness and substance misuse. Emergency preparedness was next. So I think the people who put COVID, that would qualify under that heading, followed by nutrition and active living. Food safety came in as #5, and then STIs, I saw a couple of people shout those out, was after that. So those reflect our priorities. I told you I had COVID and non-COVID priorities in parallel. I don't have the luxury of dealing with one or the other. That's how we dealt with it there. Suzanne, I'm gonna go to you to see if we have any questions in the chat yet. And if not, I'm gonna keep powering through the pre-answered questions.
So we do have a question about boosters and the availability of boosters. One of our residents wants to make sure that if she gets her booster, it won't take it from somebody else who is more deserving.
What a wonderful human you are. And sometimes I lose hope in mankind many a time, but it's comments like that that I think are so great. So if you see every Tuesday, Jasmine tries to post on our website. We try to keep some of our communications consistent. So, if you show up on Tuesday, you'll see vaccines and testing locations. Thursday, like I said, on our social media is Covet. We tell you where our vaccine clinics are if we have them that week. Any vaccine clinic that we have, we are offering vaccines and boosters. And unless we run out, which unfortunately hasn't happened because people are tired, we're going to try to honor that. Justin, I don't know if you're still on. Do you want to add anything to that? Justin has young children, so I'm not going to force, but I think I got that right. So we can move on to and I think Steph, who asked that question? Suzanne? About boosters?
I'm sorry, that was Ms. Yandra Mariano.
Are you able to unmute just to see if you are happy with that answer, if you have anything to add?
And if not, Ms. Mariano, you can put it in the chat.
All right. So I'm gonna try honor people being able to come online if they can. So I'm gonna go back to a previous question, and we'll move on to the next slide. So the question, can you share a little bit about how you are working with other organizations? Love this question because I get to show off about my partners. So we really rely on our partners for a lot of public health. The numbers I gave you about how many people have left public health as a career are devastating. So unfortunately, but we're very fortunate because we have that support, we have allowed people we have had to work through contracts and subcontracts with a lot of major partners in the city. IHN, Regional Health Commission, the county now, we do a lot of joint policies. One of the first things I asked for when I took this job was for my counterpart in the county to meet with me monthly with the leadership of our boards of health. And we have a historic number of new policies that are joint between us. My staff will put links to those in the chat. We have a joint policy on the new normal. We have a joint commentary on STIs because those went up in the pandemic, even though people weren't going to the doctor. So we need community partnerships to help DOH as we're building back work priorities. Another big example is Williams & Associate, one of our partners that delivers HIV services to the community. The Spot provides sexual health resources to teens in the community. Planned Parenthood assists in providing sexual health education. So we currently are in an STI crisis, and we have been in the city of St. Louis for a while. We lean into those partners and expertise heavily whilst I'm trying to build back our health department. So I hope that answers the question. Suzanne, back to you.
Serena Mohammed mentioned the goal of aligning the vision with actions. What is the vision for the health department? And that's asked by J.S. Thomas.
Shailene, I'm going to ask you to unmute J.S. Thomas to see if, as we're answering this, she or he has any additional, or they or them has any additional questions to ask. But I see J.S. Thomas. I'm going to ask our moderator to unmute you, and I'm going to ask you, Suzanne, to ask that question one more time.
I'm sorry, it took me a second there. Serena Mohammed mentioned the goal of aligning vision with actions. What is the vision for the health department?
The vision is to heal. The vision is to go from a place of chaos coming out of a pandemic into a system that has clear strategic planning, organizational infrastructure, and more importantly, support from my staff. I cannot continue to add things to their plate when they don't have that necessary level of support. And that's exactly what they've been doing for a while now, because the pandemic devastated all of public health across the country and the world. So that has to be a priority. Moving from that, we will in parallel be addressing the priorities of the community. Because I don't have capacity, I'll be having a very careful balance between subcontracting that work out to organizations that have capacity and really developing my staff to be able to do it. But I wanted to give you the numbers of staff here, the numbers that we've lost, so you understand why sometimes you may not see the city being able to do as much. But I've hired 22 more people and I've advocated for 31 new positions. So you're going to see that growth happen. You just have to work with us, bear with us, and advocate, most importantly, both in the city and at the state level, for increased public health funding so that we can do this work of building back our health department. So that's, for me, the connection between vision and action. I can't do any of the action pieces with an unhealthy staff and team. They need my support and all of your support. J.S. Thomas, if you would like to, how is that for an answer? Is there a follow-up question? Do you feel like that's a reasonable approach?
And unfortunately, I think you might have to put the answer in the chat.
That person's unmuted, I can see, because Shailene helped them. So I'm gonna wait to see if they can speak up, and we'll try it one more time. Otherwise, we're just gonna have to continue in the chat. But I did try, guys, for you to hear another voice other than mine. J.S. Thomas, are you able to speak? All right. Serena, did you have anything to add?
So I actually will copy the vision statement that we have from our community health improvement plan. That's a plan that we actually did in partnership with St. Louis County. And it paints the picture of where we're trying to go. So when Dr. Mahdi talks about the infrastructure that's needed, the team that's needed, the resources that are needed, the end goal is to get to this optimal health for all in the community. So I'll just post that in the chat for folks to see.
Thank you, Serena. And when the mayor was interviewing one of the things she said is she wanted to get an idea of my goals and how I operate. I'm very unapologetic that everything I do is on a foundation of equity. And as a Black woman and immigrant myself, I'm sensitive to the fact that a lot of times equity means superficial platitudes around D&I efforts without real commitment, either through funding, through mentorship, through sponsorship, through advancement, through promotion, through making sure that the most vulnerable people in our communities are the ones who are prioritized. And so rather than create a separate section that often doesn't get funding, often doesn't get capacity, even with the few staff I have, the way that I build equity in is we consider equity in every single faction of what we do. That's fiscal, environmental health, all of it. We hired an epidemiologist just around health equity. So she works with all of our other epidemiologists around that data and is working to give metrics for that in the city. I'll be giving you an annual report in October, and a year from when I started. It'll be available for everyone to see what work we've done. But as we build the health department, equity will be built into every facet, not a side piece that's sometimes ignored, as has unfortunately been historic in certain systems. So Suzanne, are we online or are we back to the chat?
I do have a follow-up question from J.S. Thomas, who was looking more for the vision of what the health department would accomplish, assuming that we had proper staffing, funding, and community support.
One more time, I got distracted in the chat.
J.S. Thomas was looking more for the vision of what the health department would accomplish, assuming that we have proper staffing, funding, and community support.
Love that. I would want to focus on new normal, increasing high risk targeted booster clinics with partners, with our aldermen, with our schools. Right now, because I have so little staff, I can only do so many clinics a week. And so we would focus on those COVID priorities. I would want to see a behavioral health bureau that's completely functional very quickly, that addresses the opioid crisis in a data-driven way, that allows us to know where to do interventions, but also provides mental health services. I'd love to be the coordinating body for mental health services. That's a very wide term. There's a lot of traditional and non-traditional ones. Standards aren't the same and aren't clear. It's the health department's job to set those. And then my dream is to build a linkage to care program. For those of you who aren't in healthcare, that came out of the work of HIV back in the 80s. When we realized that there was a one pill option that would allow people to live and die healthy and die from old age, even living with HIV, we built out a linkage to care program. Social workers, some of the true heroes of this pandemic, case managers, community health workers, behavioral health coaches, all work directly to reach out to people if they test positive at an emergency room or at a doctor's office, and really give people resources to come in for that first doctor's visit to get on medication. That decreased the time to getting people on a pill from sometimes further than a year out to on average a month out in most places in the United States. I want to see that for behavioral health. Right now, when you try to get someone behavioral health services, how many of you may have tried to get a psychiatrist or a counselor? The average waiting time in the city is 6 to 8 months. We need to decrease that time. So that would be my dream, right? And then to have the capacity to deal with violence prevention initiatives in partnerships with public safety and the mayor's office fully. I'd like to be fully steamed to be able to address that from a public health lens. Without staff, I can't do that. And I would be lying to you if I said I was doing that at full capacity right now. So I need the help of other departments to kind of take the lead with my support for gun violence while I focus on behavioral health right now, and then empower my staff to rebuild and to have those metrics. That is how I would optimally want to be right now. Does that help, J.S. Thomas? Okay. Back to the previously submitted questions. Thank you so much, J.S. Thomas.
J.S. Thomas says yes, that helped.
Thanks. Suzanne, if you could read the next question.
Do you want the question on the screen?
Yes.
I've heard Dr. Mahdi say data is justice. As a health equity advocate, what steps can I take to help manifest this powerful concept?
Guys, don't make me smile from ear to ear on this. Actually, somebody's listening and people hear my quote. So first, let me attribute that quote to the great Dr. Corey Bradley, a close friend and leading implementation specialist at a national level, but we're lucky to have him do his work right here at Washington University, who says data is justice. And I believe that is true because data, equitable data, because not all data is equitable, and so it doesn't empower the most minoritized, but data, when done on a foundation of equity, allows us to build policy, to help people, and to apply for funding. A lot of high-ranking institutions, federal programs have gotten away without prioritizing equity for decades because there wasn't a lot of robust data that we could lean in to say what was happening in the most minoritized community. And I believe the data is justice because, again, done right with the lens of equity, it allows us to say, these are the needs. You see them right here. And this is what we need to prioritize. And so for me, that mantra is key. When I talk about health equity, I'm talking about providing everyone with resources based on needs. When I talk about data being justice, I'm looking at data providing a starting point from understanding how to visualize and record health equity. It's the first step towards equalizing opportunities for better health outcomes. And I encourage you to continue emphasizing the use of data-driven policy and decision-making when it comes to public health. I'm gonna go to, I don't know if Matt's still on, to see if, Matt, do you have anything else to say about equity from a data perspective?
Yeah, it's a great
justice.
Yeah, it's a great point. And, I think everybody's aware that there are disparities in our health outcomes across age groups and, race and ethnicity. So we need to keep track of those disparities. And so, another great colleague of ours, Elvin Gang, also with the, Institute for Public Health and WashU, talks about this idea of not just equity in terms of, leveling the playing field, because that's sometimes, if say Caucasians have rates that get worse and get closer to, say, another marginalized group that has worse rates, that's equity because they have the same poor rates. But what we're really trying to achieve is, equity in terms of providing opportunity and reducing at those adverse health outcomes, but also working towards improvement, right? So it's, I am blanking on the term that he uses for that, but so using data as justice means utilizing every data source that we have to identify those gaps and then intervene where we can to improve those health outcomes, to improve the lives of our community and reduce those barriers to care, for example, where we can. So some of the ways that we do that is tracking incidence and prevalence rates of certain diseases, and then also taking in mind geographic differences and sort of these contextual things like access to transportation, rates of disability, and other conditions that might make it more difficult to seek care. So these are all things that we keep in mind to try to improve the outcomes in our communities.
One of the leaders around equity is here with us tonight. I'm going to try this one more time, and if not, it's just the way this Zoom call is set up. If Dr. Will Ross is still with us, Shailene, can you see if you can unmute him and if he has any words around data being justice and equity in general? If it doesn't work, it just means that we can't tonight, but just know that I tried. But I don't know if you're able to speak, Dr. Will Ross, once.
Sure. Well,
thank you, Dr. Ross.
Thank you, Dr. Maddie. I really appreciate that answer. Ultimately, in public health, our overall goal is health equity. We want to reach a point where every individual is reaching their full health potential. We can't know if that's happening if we don't have access to data that's disaggregated, that is actually reflective of all individuals by race, gender, ethnicity, and so on and so forth. For a long time, we didn't have that data in St. Louis. That was disaggregated, and even the hospital systems didn't have that. And so we talk about health equity, and yet we don't know how what sort of initiatives would work because we didn't have the data. Well,
right.
that has changed, and as a consequence of having access to this data, then we can move forward in our goal of promoting health equity. And so the comment is so sound, it's profound, and we're in a new state now where we have ready access to data that's being shared across systems and hospitals and health departments. So thank you, Dr. Maddie.
Thank you so much, Dr. Rawson, for your continued leadership. You paved the way for health equity in the region and have continued to support the city and the county in public health. So back to you, Suzanne. Do you have another question?
I do. I've been trying to scroll through to find it, but I believe I have the gist of it. And Darius, you can correct me if I'm wrong.
It's Darius's comment, right?
Yes, we have a lot of residents, primarily Black and Brown people, who are rushed to the emergency room for ailments that could be treated through routine care. Is the Department of Health working with the Board of Health to create a sustainable solution and provide primary routine care for all of its residents?
So I love this question, and shout out to Darius, who, man, if I don't even know how many labels I can provide Darius Rucker. Darius Rucker is an activist, a leader, an ally. He will show up for the health department for free, but he'll also hold me accountable with tough questions like that because he cares about the people more than he cares about me having a good look on camera. So this is one of those times where I'm going to keep it real with you. That should be a priority. Do we have capacity right now at every other priority that I told you we had? Not for that direct question, especially since the health department hasn't had a clinical arm. So the county has clinical services that it provides. The Department of Health stopped providing clinical service years before I got here. And so I'm in the position of building back, just supporting the current staff I have, and then moving us through a strategic plan to provide strategic clinical services. I think that would go a long way to helping with what you have. Now, what I do have, Darius, is that I play well with others. That was something I got on my report card a lot. I work very well with other directors in the city. And I'm so lucky that I was sworn in on the same day as the new director of Human Health and Services, Dr. Yusuf Skogan. So he oversees a lot of the aged, the homeless, and housing needs in the city. In many cities, those two departments are actually the same. So it's great that him and I work so well together. He can call me, text me. We go to do town, neighborhood meetings together because our work is so aligned. So we have worked together in smaller areas around this issue. But Darius, this is another example of how there is no way with the capacity issues I have that has a full built out strategic plan. So what we want to do is provide support to Dr. Yusuf Skogan and his team as they focus on our elderly communities. I did that in multiple ways. I try to make sure that each of my bureaus, even with small programming we do, right? Providing N95s and antigen tests, we're still providing those and prioritizing our elderly community. We're doing education. I was just at Forest Park talking to over 200 of our elderly, most of them for Black and Brown communities this last weekend. But that very issue of making sure that we can divert care from emergency rooms to primary care is difficult. So what I do think we do well here is I am unapologetic that while I have the giant WashU, the giant SLU, so many community colleges and other academic institutions, my number one partners that I go to first if I have funding to provide are our federally qualified health centers, because they do have clinical services and they don't turn anyone away. If you don't have insurance or you don't, if you have money or you don't, you can go to one of those community-based hospitals that serve the most disenfranchised. And we are lucky to have 4 of them right here in the city. They are amazing partners to me. We have a lot of contracts to them for work around COVID, communicable disease, health, wellness, and nutrition. And where I don't have staff, I try to get them the bulk of the funding that comes because I know that they prioritize the most vulnerable. So that's one of the ways that I'm doing it now, Darius, while A, I don't have capacity to make everything a priority, and B, I just don't have clinical services yet. Shailene, if you could unmute Darius, because I know he's gonna hold me to the fire, child.
No, that was very helpful, and I appreciate you sharing that and continuing to lean towards equity. You know, that's something I care a lot about. And I do believe fundamentally that figuring out how to, move away from folks entering into emergency spaces for things that are preventative can change drastically the way in which folks experience healthcare.
Yep.
And appreciate you all continuing to push towards that and for your leadership.
I appreciate y'all. And he's not just being nice to me, because Darius will tell me if I need to push harder on an answer. So I do appreciate that answer and his leadership in general. But I couldn't agree with you more. Our emergency rooms are not appropriate primary care. And God bless our nurses in the emergency room, our catering staff, our cleaners, and our doctors in the emergency room, because they have to be emergency services and primary care for so many people, and they're put in really difficult positions. So we are trying to support the federally qualified health centers and community grassroots organizations. I think about the T, headed by visionary Dr. LJ Punch, who provide behavioral health and gun violence services, clinical services, as well as education throughout the city. We give them as many of the resources as we can. So that's a great question. Thank you for asking it. What is next as a pre-sent question? And we have about 27 minutes left, so we're just going to keep powering through. Feel free to keep me on volume, go get some water, go to the bathroom, but don't drop off. I want to show that people care about public health and that it's a priority. So let's stay invested and talk about what we can do to support you guys. So next question from the slide sets.
From the slides, how will the region address gun violence?
Whew, tough one. And being that this is the #1 priority, I think we have to talk about this. So I'm going to come to a couple of people who are in the chat that I know and trust that they're available, but I'm going to start with some comments myself. Listen, I can't speak for the region, because while I've reached across the aisle and I meet monthly with the county, they were willing to do that with me. While we've done a lot of policy, I still can only talk a little about the city's efforts and related around gun violence. One thing that the city is doing to address gun violence is the city is creating of the mayor's office for violence prevention. She wants leadership right in our office that hold me accountable, public safety accountable, and all the other departments that really should come around gun violence, right? If you think about it, it's a public health crisis first and foremost, but it's a public safety crisis, right? Definitely a crisis with our within public safety and our police force. It's definitely a crisis within human health services. Because we need those wraparound services to support folks who are subject to it and the trauma, both chronic and acute. And so that office is going to bring all of our violence intervention programs and efforts under one umbrella. One of the things we did was took ARPA funding, put out an RFP, got 17 applications, and funded 8 programs that only 2 have previously been funded before, with funding around a variety of gun violence initiatives. People who care about domestic violence with women, people who are in North City and South City, where we have some of the worst numbers chronically, and some of the big organizations. I have to shout out Pure Violence that has done a lot of this work in the city, so helping them, but really trying to champion some of the other organizations. Because we only partially funded people that we've supported before. We gave full funding to new organizations. That was just a month ago. So you'll see that work. Behavioral health response and the 911 call diversion is another area that we do work alongside Cure Violence and cops and clinicians. But and they're all provide better coordination services, right? So a lot of these programs are upcoming in the fiscal year, but studies show that violence correlates directly with levels of poverty, racial segregation, patterns of disinvestments. So Mayor Jones has plans to begin turning this around using ARPA funds to prioritize economic empowerment as well in the coming year. All of that feeds into gun violence. It's not a unidimensional issue. And quite frankly, I didn't have a lot of support as one health department trying to address all of gun violence. So her taking that initiative to provide us with support that coordinates all of our efforts, us expanding funding so that we provide care to small roots grassroots organizations. So people who know what an RFP is, it's basically an application or a bid for funding. If you're a small roots grassroots organization, you don't have the support to have a grant writer. I don't even have a grant writer right now who just works directly for me. I don't have one person who writes policy. So I put my 5-year-old and my 2-year-old to bed at night, and then I go home and I start writing policy with Suzanne Alexander, who that wasn't her job either. We've cranked out, Suzanne, how many policies have we written together since I started?
COVID or everything else?
Everything.
Probably a dozen.
Right? And so we're literally writing this into the history books in real time, but that takes time, right? So we need that level of support, but we also need to support. And if the health department is struggling to find support for, data analysts and how they can report out in their application that they're going to oversee their data and report it out, what more a small grassroots organization that's a trusted messenger that's done this work for decades in North St. Louis, for example, but this doesn't have that. So they continuously don't get funded. So the other thing the mayor's office did was to provide us with support for a consultant who worked to help write applications with smaller organizations that couldn't, answered their questions. And we were able to fund organizations, grassroots organizations that have the trust of the community that have never had it before. There was a question in the chat about who the FQHCs are. My staff have lifted those in the chat for you and provided some links, so you can read those here. And yeah, so I hope that's a great answer. Let me see who I can come to put on the spot around violence.
We have a question, Dr. Mahdi.
Yeah.
The community survey, do we have a link to that, or are they still making the dashboard for that?
Yeah, we're still making the dashboard. And so Harold, how soon will we be able to have forward-facing information? Are we still working on that?
We are still working on the dashboard. I think maybe by the kind of latter part of July, we should have it up in the next fiscal year.
Yeah.
Thank you, Stephanie. I hope that answered the question.
One of my other leaders that didn't get a chance to speak before, Craig Schmidt, is on. I don't know if you are available to be unmuted, Craig, but I'd love to see, you have some of the most experience with city government, both from the Board of Aldermen side and for public health. You support every single department here. Closest thing to a chief of staff I have. Do you have comments around gun violence? Did I leave anything out? And are you available, Shailene, if you can unmute Craig? Craig Schmidt. Okay, I don't see him coming on, so those answers will have to suffice for now. I know there's keep your questions coming. We're going to move on and we'll answer more questions as they come. So back to the slides.
What's the status and impact of the Cure Violence program in the city and surrounding communities? And this dovetails with a question from James Page asked live about who we can contact to engage Cure Violence and other programs in our communities.
Yes, thank you, Alderman Page, for being here. Your leadership is so valued. You've been a tireless advocate for gun violence for your ward and also just in the region in general. So I appreciate you, and I'd love it if Shailene, if you're able to get to James Page and unmute him for comments. I'm going to start with some answers. I'm going to ask Matt to prepare with some of the data we've been showing around Cure Violence and some of the exciting things we have to show that will help us support Cure Violence more. So our Cure Violence program is showing remarkable results in targeted catchment areas in Wells, Goodfellow, Hamilton Heights, Dutchtown, and Walnut Park neighborhoods. Firearm-related violence is definitely down in those areas. I recently met with team members. I went to visit them directly. We had a roundtable, and a lot of people are being very nice here. They were extraordinarily polite, but held me to the fire, because you've got to remember that this is a program that's built upon the very people who have faced that gun violence, who live in these neighborhoods, who haven't been supported, being good enough to say, I want to be a part of the solution. But they need our support to do that, right? Because we're asking the most disenfranchised to lead, but that model has been so successful because they have the trust of the community. So I recently met with them and really felt that dedication and commitments to violence interruption work they're performing in their voices around the meeting. We know that there are other areas in the city that would benefit from expanding the area. So that's that work, those applications we took, expanded some of those programs out. And we're hoping that they're going to expand little by little as we go out. So I'll stop there. Matt, can you talk a little bit about one of the things that I focused on was trying to get really robust data around Cure Violence. And we have another leader here, Victoria Nwuri, who works in our Institute for Public Health at WashU, who has partnered with us around that very data. So if Victoria is available and wants to, we can bring her and unmute her as well. But her team has supported us for years, at little to no cost, but also has been a great partner around gun violence. So Matt, what kind of things have you been seeing as you've been analyzing data, and how will that help us with interventions in the future?
Yeah, thanks, Dr. Mahdi. So we received data from the police department on 3 major gun violence charges, and that's aggravated assault, robbery, and homicide. So we map those incidents every month and compare and contrast trends over time to see where gun violence is happening in the city. So in our Cure Violence reports, we create heat maps and do some hotspot analysis to see where in the city are these events happening, and sort of disaggregate them by charge. So focusing in particular on homicide, the most severe outcome of those events. And then we track the number, and both for the number of charges, which is how the police department tracks. It's called NIBRS data, and it tracks if there are multiple victims, that's multiple charges. So that's how those data are reported. But we also present the data by the number of incidents to see if the number of incidents are increasing or decreasing over time. So the NIBRS data is only available from 2021 onward. So that's how we're reporting now. But we have seen, of course, violence has a seasonal trend. So in the summer months, it increases, and we are seeing an uptick in the number of incidents going into the summer now. So that's something to keep an eye on. But like Dr. Mahdi mentioned, we have 3 Cure Violence catchment areas that are the primary focus of the program. And we have seen that the violent incidents in those areas has decreased compared to previous months and years. So whether or not that's related directly to the Cure Violence program, that is something that Victoria can talk about, because her team is doing an analysis to evaluate the Cure Violence program. So if she is available, I will let her.
Victoria, if you want to unmute or have anything to say, it's okay if you don't. I'll take some comments from you, and then I'll come back to Alderman Page. Charlene, if you could unmute Victoria and Worry.
I've asked her to unmute.
Okay, great. So she may have stepped away for a while. Alderman Page, thank you for your leadership. Did you hear things that are promising? What response do you have? Was this a good first step for us?
I think it is, Dr. Mahdi. I think it is indeed a good first step, and not to prolong the situation, but some of the reasons why I asked the question about Cure Violence and other programs. My constituents are constantly under siege.
Yes.
A constant situation. 3 very quick examples. One was a constituent that I met with in her home. Of course, I can't identify the person, of course. Was hiding in her bathtub for dear life as shots were fired through her doors and walls of her residence. Fortunately, she was not injured. Another family that I worked hard to help get into stable housing in one of my affordable housing communities, got them in just on the Thursday before this past Christmas, so the kids could unwrap their Christmas gifts in their new residence. And within a couple of months of that time, the lady's 14-year-old kid was shot outside of the unit in a drive-by. Fortunately, he survived. He was shot in the leg, but I think he's probably going to live with a limp for the rest of his life. Last of the 3 examples, just this past weekend, I was out documenting derelict properties for potential demolition. And all of a sudden, a person in a vehicle, won't give any more descriptions than that, let fly with about 12 or 15 shots out of that vehicle, a half a block from where I was. And, it's this kind of thing just goes on constantly.
My God.
That's why I'm seeking solutions. I'm not trying to pinpoint anyone. I'm just seeking solutions that would help people see that this is not the answer. This is not an ideal way to live. This is not a way to redress grievances. So that's why I asked the question. It's from life in the streets with my constituents that I'm always about.
Listen, Alderman Page, you never have to explain yourself. You are speaking on behalf of your community. Your job is to hold us accountable. You've always been respectful and supportive of me since I've known you. But your job isn't to coddle me or anybody else. My job is to do this work to the best of my capacity. And the aldermen and women have always supported me. That's never been an issue. And you have to push because people are dying. So we can't put my ego on the line while we see people dying. So one of the things I think I want to keep it real about is the unfortunate thing that's happened to Cure Violence is as one group, they have now got the full weight of curing our community of violence upon their shoulders. And a lot of the questions I get is, what are they doing? What are they doing? What are they doing? They're doing a lot. And one of the things I charged Matt with is we need both quantitative and qualitative data. Will Pinky, another fearless leader, and Serena Mohammed, my board chair, were very vocal about that. They said, I think it's important for us to not only give numbers. It's easy to say, oh, look how many shootings there are, but what's the work of Cure Violence that you can't measure in numbers? How many people find housing, jobs, come off the streets, right? And I think we have to pay attention to those kinds of data and not hold Cure Violence solely responsible. That's why it was important for us to support so many other community groups so we can see improvement from a wide variety of cases. Because gun violence, if you look it up in a public health textbook, and this is where the nerd in me comes up, the different academic approaches to it, there's more than 15. Cure Violence with limited budget cannot address all 15. You still have to hold us accountable for, though. That's why I wanted to do data and metrics. So you will get monthly reports. The aldermen and women have enjoyed bi-weekly, sometimes monthly COVID detailed updates from me. You're gonna have the ability to get the same kind of data sets from me, both on our website and through some of those more intimate emails, right, for core leadership. Because it's important for you to see where we need to work on and where we need support. But then I need people not to sit on their couches and constantly say, what are you doing? I need you to say, as a public health expert in an academic institution, what am I doing to better gun violence? I know what Victoria is doing. She's giving us much needed data support in WashU, right? I need you to say, well, what am I doing as a teacher in schools? Okay, let me reach out to the health department and see what resources they have for young children, and we'll send those to you. I need my aldermen and women to say, sure, Cure Violence has done a great job, but we need a lot more. How can we push for more funding for public health? 1% of the city's budget. Missouri is number 50 in the country for per capita spending on public health. The range is $7 to $215. As of 2020, we were $7 per head. So this level of a disinvestment is deep. It's at the federal, the state, the city level. My boss, the mayor, inherited it and can't be expected to turn it around in 1 year. I certainly have been here for 6 months, and it takes time. So it takes all of us as active participants to see how we can advocate, but also hold us accountable. Alderman Page, am I talking fluff or are you feeling me here?
No, I feel you, and thank you so much.
Okay.
I'm just that mirror.
Yes, and you
reflecting the issues going on in my community.
Yes, you have to be. You can't let down. Not to save me and my feelings, even if I've had a bad day, a hard day, I'm sick. You still have to be that mirror, because I get to go home to a beautiful home, a partner who supports me, and a lot of resources. Many people in these communities don't, so my ego can take a backseat. I'll be okay. It's rough sometimes, but I'll be all right. So I think that's important. So continue to be that mirror. I just encourage other leaders to be fair when they ask those questions and to think about capacity and to think about how to get us additional resources as opposed to always playing the blame game. One thing I've always loved about you that you never do, ever, ever. Thank you to Stephanie in the chat who says, love that you emphasize the importance of quantitative and qualitative data. So important. Numbers don't tell the full story. Okay, we've got about 9 minutes. I want to make sure we're getting to all the questions. So back to you, Suzanne.
Okay, there have been a variety of questions asked around this theme about COVID-19, the new normal. And the one I want to ask is, did we drop masks too soon?
Child, I'm gonna be honest with you. I feel like, heck yeah, we dropped masks too soon, right? I was one of the last cities in the country. I was holding it down nationally. I'm very proud that I was one of the last cities in the US that had a mask mandate. But when you think about public health is community level. And if I'm not empowered at the federal level, if I'm not empowered at the state level, It's very confusing for me to be an island in the city that has a mandate in every county around me because they're being sued. Think about just how that broke us as public health leaders, that we're literally being sued around public health for just doing our jobs. None of us have to do this. All of us took significant pay cuts to do this job. Be very clear. Every leader on this call can make close to double, if not more, if they went into the private sector, right? We don't have a leg in this game. I can go back to being lauded as a freaking doctor with my white coat and people thinking I'm some sort of special being, which is really haughty-taughty and not really who I am if you know me. But we have no stake in the game. So to have people be actively sued, schools being sued, public health schools, the ones with the least amount of public health. If I put them in a position to have a mask mandate, and then I'm having public school teachers emailing me, we are onslaught. We're trying to keep kids safe and we're being sued. And I know that we're not really an island. The county and the city are one region, right? So my mask mandate has to be supported with what's happening around me. So today I have to make the tough decision. Today's day one of me finally having red zone of high community and high transmission levels, both at the same time. Anywhere else, that's a slam dunk for a mask mandate. Last year, we were in a surge that's lower than this. We had mask mandates, we were limiting social events. The reality is this took too long to get on top of, and we're just not able to balance it. And I don't like to let my blood pressure rise and be judgmental with federal leaders because I don't know what it's like to run the CDC. And you will never find me running for anybody's president, vice president, or anything, because this mouth, as you've noticed, will get me in big trouble. And it's stressful. I don't have the expertise to balance all of the different things to keep a country running. But in my role as a public health expert, we absolutely should be masking indoors. I have said that consistently, even though I removed the mandate because I had to make that difficult decision. Department of Health has said, strongly recommend masking indoors consistently since the mask mandate. And I went to the Board of Aldermen and they supported me in putting a board bill together to say they recommend strongly masking. So we're clear in the city of St. Louis, right? But I'm not, I'm a freaking health director in a city in Missouri. I do not have the might and weight and the empowerment of our national, state, and federal organizations. And I have to think about how difficult it is for the public to balance these things when I make a decision. So I get hate mail. If I have a mask mandate, half the city hates me. And if I don't have a mask mandate, half the city hates me. That's okay, because I'm still gonna do my job. So yes, tonight, I'm not gonna have a lot of sleep. I'm gonna be thinking about next steps around the utility and cost benefit analysis of a mask mandate, being that we're in the red for both. And the CDC is supportive of that in this instance. But I know that a lot of my partners in surrounding counties can't. And I hate that for them. I hate that for them. It's so unfair that they're put in a position to protect public health and are not allowed to do their jobs. It is shameful. And it's the thing that made me the saddest and the angriest as a leader. And that's just me calling a spade a spade. So there's going to be so many interesting quotes in the newspapers tomorrow.
I want you to get it out, though.
Some fun questions. What you got for me?
Final question. How can an artist help support the DOH?
How cool of a question was this? I love this question. So we work with some really cool leaders. So I showed my age, my auntie age. I recently celebrated a 40th birthday. And while I think I can still do a few dances and drop it like it's hot, I really can't. And the wonderful young men and women of story stitchers, young people who use dance and song to advocate around leading issues, public health being where they partner with us. They get on TikTok because I don't even know how to use it, child, and I'm not going to learn today. The fact that I engage on Facebook, Instagram, and Twitter is as much as I can give you guys, because I'm somebody's mom, wife, and I'm an older lady. But we partner with them and they use their youth, their innovation. They do dance. They connect with other young people. I just took an amazing call with Koran, who is a leader and a young person in the city who uses his own journey around mental health to go into schools and be a motivational speaker. He's brought together influencers. I didn't even know what that term meant until recently. Influencers, people who are popular on social media, to really rally them around important issues. I'm going to work with him. So there's so many ways that artists can, but according to the Creating Healthy Communities Arts and Public Health in America initiative, the arts can be especially beneficial for public health in 5 key areas: in collective trauma, in racism, in mental health, in social exclusion and isolation, and in chronic disease. Providing people with art in all its different forms, song, dance, art, can be healing. I know it is for me, and I hope it is for many of you. So we think it's a powerful connector and educational tool to many public health issues. I've actually looked into increasing my budget to just supporting local artists and giving my staff more than gray walls and cubicles every day as they do this important work. So I encourage you to contact our public health information officers to discuss how you can assist DOH in improving community health and well-being as an artist if you're interested. I just love that someone thought this was important. And Karan Bolden, Bold Moves is his company. He will do work for us for free, but I'm tired of asking the most disenfranchised Black and brown people who to do the work of the oppressed as the oppressed for free. So we've got to find them funding streams and reward them for their work as they take the lead in trying to fix a lot of these problems. So thank you for putting that in the chat, Serena. All right, I think we can take one more question from the chat, and then I'm gonna see if I'd like people in the group chat to put comments on how tonight is going. Has this been helpful? What was good? What would you like to see improved in the chat as we're about to leave? And while I'm answering the last question, would appreciate your community in the chat right now. So Suzanne, over to you.
Well, I'm going to take one that's sort of a question, but also a comment. The question was, could someone repeat the fact that Dr. Mahdi said about how Missouri ranks number 50 in the public health spending per capita?
Yeah, so Harold has that statistic. I think, Harold, it was from 2020 or 2021 from a leading public health institution. Harold, you can put that in the chat. I know you had that quote from a recent talk we did, so he'll put it in there. But it was $7 to about $215 back then was the range for public health spending per head. And at that time, Missouri was ranked number 50. Now, let's be fair, there's many people who collect data, but this is a known national public health data set that was used, and that's where that quote came. So getting some good feedback in the chat, great town hall, very helpful. What are other folks thinking about tonight? What would you like to see? Do you want more of these, less of these? What else do you want to see from us? And I'm going to quickly do some rapid fire question answering, and I'll stay on a few minutes with folks who don't want to drop off. What is the new normal? I promise that is an update. I think it's important. We needed to get to herd immunity. We're not there as a nation, so we're having to make compromises. What that means is we'll continue to see variants. And what that means is while the healthy people, vaccinated, boosted folks who don't have a lot of health conditions will roll their eyes and say that this was all a farce, it's because all the sick people are in the hospitals. I know because I took care of them for 2 years. I was in ICUs with the sickest Black and brown communities, people over the age of 65, people with high blood pressure, diabetes, and most importantly, most of them not vaccinated or boosted who were sick and died. And if they're not in your close circle, if you're not one of those people, you don't know that. And that's why I don't have the luxury of thinking about public health as from an individual level. My job is public health. By definition, it's community. And so we have to focus on that moving forward. So the new normal is going to be continuing to march to herd immunity. I'm not going to stop with vaccine and booster clinics. I'm going to try to get more funding for gift cards. I saw that question in the chat. That was an ARPA line of funding last year. We've run out of the ARPA funding. We've applied, we've asked the mayor's office to extend that. I'm looking for other revenue streams. So all of the federally qualified health centers and the health department are to our last gift cards. There'll likely be a break where we can't give them until we get more funding. But that was ARPA. It was a certain amount of money. It ran out because it was so popular, because people need support. Not because we're paying them to do COVID, because I purposely would not give them until people have actually asked questions about the vaccine, made a decision, gotten a vaccine. It's the last thing that you can sign up for. But you don't know how hard it is for someone to take off from work when they're not allowed to, or don't have transportation, or couldn't pay a bill. So they sometimes can show up because they're like, well, I'm going to get a little bit of support for my day-to-day life. And I don't make apologies for that. Other comments in the chat. This was a great session for communicating directly with stakeholders and the general public. Thank you so much, Victoria. You have been a leader way before I was one. You saw me as a student at WashU and are very gracious in allowing me to be the director of health around you, but you supported me as a fellow, and you never ask for, you never see you in the paper, but it's because of you and your team that we have so many of the resources. I cannot, as a women leader, I look up to you, so thank you. Great information, thanks for sharing. What happened to the use tax funds for healthcare? I'm going to look into that, Rhonda. Rhonda is, I think this is Rhonda. Yeah, Rhonda is one of my leaders. She is actually leading the accreditation process for the city, her and her team, and have doing great work. Great information. Thanks for sharing. Love your passion, Dr. Mati. I feel so supported by you, by your team. Ooh, crying. Thank you. I don't know. I took Latin in high school, have forgotten it at all. So I don't know what that means. Please give me the interpretation and shame me for forgetting all my Latin from high school. But great town hall, Dr. Fletchway and all. Thank you for all these comments. We're going to try capture them and give them back to the community. Suzanne, any lasting questions for people who are choosing to stay on? And everybody is happy to go home. I can't believe almost over 100 people rocked with us for most of an hour and a half. I'm so proud of us. But I'll stay on for a few minutes. Suzanne, if you saw anything that I didn't get to.
I'm looking, it's hard to go through the chat. So if anybody has a burning question that has not been answered, please do use the Q&A box so I can keep up with it. All of our questions in the Q&A box have been answered. If anybody has more interest in specific general topics like COVID-19 or the additional programming that we have at the City of St. Louis, please put that in the chat box.
Man, shout out to Tyrell, who works for me, who's pumping me up. He knows I'm nervous and I talk a lot, verbal diarrhea when I'm nervous. So he's trying to give me some love. Thank you, Tyrell. He is one of the leaders around the all of our HIV initiatives and the at-home testing kits. One of the most creative people I've ever met. I learned from him. And Bean came back with the translation. Public health is supreme law. I got to bow to that because that's how I need to get our budget from just 1% to higher, because I do believe public health is supreme law. You can't do anything else in the city if you are sick or dead. So we need to support public health. Come on now. So thank you, MB, and you're my spirit animal. I hope I get to meet you at some point. You see all of our Twitter, Facebook, Instagram. That's the handle. It's the same handle across all three. Sign up, getting to people. When your mentor says, Dr. Monty, congratulations to you and the staff at the health department on a very important interactive session. The community appreciates your leadership. Man, a little tear, you know, it's helped. One of our clergy advisory board members, Min Lu, asked about, said very helpful indeed. I hope to see more conversation about our investment in public health. Love your passion. The clergy advisory board are leaders that the health department brought together way before I came on as director. I can't take any credit for it. This was championed by Dr. Eccles and the health department before I came on. They have led initiatives around sexual health, around COVID, around a host of other initiatives in the city through faith communities. Tough conversations that you wouldn't expect in a church they took on hand on. They were the first ones who challenged me to get funding for N95s and antigen tests, and then they went door to door and gave them to their community members. Man, that is community in action. We have a lot of great leaders in the city. Thank you to our aldermen and women. Thank you to the mayor's office who supports us. We're getting a lot of good feedback. You guys aren't mad at me today. Suzanne says that public health is supreme law is tattoo worthy. If I wasn't such a wuss, I would get a tattoo, but I am a wuss, so I'm not.
I'll do it for you.
Listen, Stephanie wants this on a quarterly basis. I was only going to do it twice a year. My staff may be mad that they have to do this so often, but we'll come back as often as you want us. Oh my gosh, I'm overwhelmed. So much positivity in the chat. Thank you to all the leaders, the participants. I got to run home and I've missed bedtime for my babies tonight, but I could maybe go kiss them on their back or they could peek up at me if they're not asleep. So I'm going to log off and get home. I'm proud to work for the city. I'm tired. I'm discouraged a lot. This is hard, but I will continue this fight and I appreciate your support. Please don't give up on us. And please support my staff whenever you see them. They do the work. I get a lot of the glory. Thank you so much for joining us tonight. And you guys can go about your day. Oh, hi, Dawn. Oh, thanks, Dawn. As a previous, okay, no, we're done. Okay, I can stop talking to people. My voice. We're still live, right? Shailene, are we still live?
Yeah, I'm about to end it.
Okay, you can end it whenever, but will that take us out of practice session too?
Oh, we've been out of practice session because you've been on your thing, but so I'm just going to end the meeting altogether.
Okay, so let me just thank this group here. Thank you, Shailene. You rolled with the punches. You guys are amazing. Thanks to everyone. Minlu, don't laugh at me. I'm so awkward. You know I'm awkward. Bye, everyone.